Hi, Dr. Zakir Hussain with you, Senior ENT Consultant. So this is part 2 video of allergic fungal rhinosinusitis, and in this video we are going to discuss only about the treatment plan. So it will be better that if you see the part 1 and then you watch the part 2 so that you can have a complete picture. Now once it has been diagnosed that it's a case of fungal rhinosinusitis, the mainstay of treatment is going to be surgery. And our idea is we have to remove all the fungus and restore the normal function of the sinuses. So that's why the term F here, functional. And we are going to perform the surgery with an endoscope, so endoscopic. So the operation is going to be in the sinus, so sinus surgery, functional endoscopic sinus surgery. So in the surgery, our idea of doing the surgery is 1, to remove the whole fungal load, 2, to give a good ventilation to all the sinuses which are involved, 3, and there should be a good drainage also, so post-operatively, so that it doesn't form again. So usually when the patient comes for post-operative care, and after the surgery, we will be able to well visualize the sinus properly. Now, coming to the surgery part, you need to be admitted and the hospital will have a consent form in which the diagnosis will be written and the surgery too and the complications of surgery. So you have to go through the whole, you have to read the whole thing. The patient need to sign and put in your signature and write your name with the date, and there will be a witness who need to sign and write their name and date, and along with that I or any other ENT doctor who is there with you, they also will do the same thing. Now same time all the investigation could have already been done. So with all this investigation you have to meet a physician who will give you a clearance for surgery. And sure, you have to get the clearance from the pulmonologist too, which I have already mentioned in part 1. So with this physician clearance and the pulmonologist clearance, you need to see the anesthetist. So anesthetist, after examining and few advice, they will tell you whether you are fit for surgery or not. So surgery, suppose you are undoing the surgery day you are posted on Wednesday. So on Tuesday night 12 o'clock onwards, you are supposed not to drink or eat anything from midnight 12 o'clock. So let me tell you some of the complications of the surgery, functional endoscopic sinus surgery. Only a few important ones I will tell you. One is nasal complication, which is hemorrhage, the most important, which can be intraoperative or it can be post-operative. So post-operative, it can be within first 10 days, and the chances you may get infection also, bacterial infection. Eye complications are since we are using debrider and other high-tech facilities, there is a possibility that there may be damage of the eye muscles, and there may be there will be bleeding from the nose into the eye, and there will be secondary effect. There will be a bulge in the eyeball, will be pushed forwards, or even it can it can decrease the vision too. There have been cases reported where blindness has been reported after the surgery, but it is not very common. And with the advancement of all the technique, the complication has come down drastically. Now the last one, intracranial complication, I like to tell you that the brain, it is covered with, it has got a good covering which is called the meninges, and it is filled with a fluid and the brain floats in that. So the fluid which is called as the cerebrospinal fluid. Because of the surgery, if there is a breach in the covering in the meninges, there will be a leak of this fluid which is called as CSF leak. Or there may be infection of the covering which is called the meninges, it can result in meningitis. And because of the breach, the infection can spread from the nose. Either air can track inside the central nervous system into the brain, or even infection can track into the brain and result in brain abscess. These are the complications, but this is not that common. Please don't be afraid of that. Just completion's sake I have mentioned. So this surgery usually takes less than 3 hours. In uncomplicated cases, it takes less than 3 hours. So one clipping I would like to show you where I am removing the fungal debris from the right. This is the fungal debris from the right maxillary sinus. This is how it looks like. This is in one patient from the right maxillary sinus. Likewise, I like to show you one more clipping where I remove from the sphenoid. So, I will take in my endoscope inside to visualize the sphenoid sinus. There it is. And if you see inside, you can see the fungus here. So, we will be wondering that it is so small, it is not occupying the whole of the sinus, but how it is happening with so much of this patient, he was admitted to the complication that he was not able to open his left eye, and it has involved his eyeball too. So, like how I have mentioned the part 1, it is not the fungal per se or the size of the fungal which affects the person or the patient. It is the presence of the fungus, it alters the immune system which produces a complaint. Now, usually what you see is, we may see a thick greenish yellow discharge like this with small studs. These are called as eosinophilic mucin. This is intraoperative finding which is very common in the case of fungal rhinosinusitis. So, after the surgery, you will be brought back to the room or to the ward wherever you are from, and for next 4 hours you will be advised not to eat or drink anything. Meanwhile, you will be for the rest of the day you will be in propped up position, and meanwhile IV fluids will be going on, and the staff nurse will be repeatedly checking your vital signs like heart rate, blood pressure, oxygen saturation, respiration, any bleeding or not, any temperature. Now, that particular day of surgery, you may experience slight headache along with facial pain and watering from both the eyes. All these can be contributed to the nasal pack which has been placed intraoperatively. Once the pack is removed, all these complaints will go off. Sometimes some of the patients, they may have swelling around the eyes which will subside in 2 to 3 days, and we will give you special advice for that. So, along with that, you will be getting IV painkillers, and subsequent day morning the nasal pack will be removed. When we remove the nasal pack, there will be bleeding, the blood clot as well as fresh bleeding, which stops by itself within say about 5 or 10 minutes, and we will apply some nasal drops too. You have to wait for at least 2 to 3 hours, and say suppose we remove the pack by morning 9 o'clock, by 1 o'clock say you can go home, you will be discharged. That's what I mean to say. Now, the advice will be from the subsequent day. Say suppose the pack has been removed on Tuesday morning. From Wednesday onwards, you are supposed to start using nasal wash. This contains sodium bicarbonate and salt. So, you want to know in detail of how to use it, how not to use it, and how to do in a proper way. You can watch my video, Dr. Zakir Hussain ENT nasal wash. You will get in detail. And either you can use nasal wash or spray, that is salt spray. Now, after a period of 1 week, that means after during the first visit, after a period of 1 week, we will advise you to start using steroid nasal spray also. So, steroid nasal spray, the dosage will be 2 puffs twice daily for the number of days which your doctor will tell you. So, nasal wash and nasal spray, please do not stop till we tell you. So, steroid nasal spray, though it is a steroid, the full effect is only in the nose, and the systemic absorption is going to be very less. So, if you want to know the technique, how to use it, how not to use it, what is the proper technique, and how to decrease the complications, you can watch my video, Dr. Zakir Hussain ENT steroid nasal spray, and you will get in detail in YouTube. Now, some of the patients, they have severe allergy. So, these patients will need antihistamine along with montelukast, that is leukotriene inhibitors. Some of them or most of them, they may need a short course of oral steroids too. As you know, steroids are strong medications and with so many side effects. First, let me tell you about the dosage. Suppose you need 50 milligrams per day, and each tablet being 10 milligrams, you need to take 5 tablets in the morning, that is 50 milligrams in the morning, soon after breakfast, and nothing in the afternoon, nothing in the night, and this will go on for 5 days. Subsequently, every 5 days you keep on decreasing 10 milligrams. So it will be 50 milligrams first 5 days, 40 milligrams next 5 days, 30 milligrams next 5 days, 20 milligrams next 5 days, and last 5 days it is going to be 10 milligrams. Some other doctors, they may say that you can take the medicines in the morning and night. You can divide the dosage. Even that is allowed. You can do that also. So that depends upon your operating doctor. So steroid, let me tell you some of the side effects. The blood pressure, if you are a hypertensive patient, the blood pressure may shoot up. And if you are diabetic, the blood sugar level may shoot up. And if you are acidic or even otherwise, acidity may be more, gastric acidity will be there. So my advice to you will be, please see your family physician every alternate day and get your blood pressure checked and blood sugar checked. And for sure, we will prescribe some antacids and proton pump inhibitors like omeprazole and pantoprazole, which has to be taken empty stomach before taking these oral steroids. So other complications of steroids are, you will put on little weight, it will be round face, some hair fall will be there, skin stretching will be there, pedal edema may be there, and there are some more, but all these complications usually it is seen only when it is taken for months together. But here in ENT we are using only for a short case of 25 days. See, some of the centers, especially abroad, not in India, especially abroad, they prefer to use Manuka honey after a period of 1 month after surgery or whenever the patient comes for review. Manuka honey is mainly from New Zealand and has got a very good effect on to bring back the normal function of the sinus. The problem is that it is, though it is effective, the cost effective, it is very costly. So only some centers do it and only some patients prefer to use it. Now, discharge medications. You will be given a course of antibiotic along with painkillers and nasal drops, 3 drops 3 times daily for 5 days. And already I have mentioned you have to use nasal wash 3 times daily and steroid nasal spray, which is to be started only 1 week after surgery. And do not stop, I am repeating, do not stop the nasal wash and steroid nasal spray until your doctor tells you. And you have to be in regular follow-up because the chances of recurrence is more, the allergy, in case of allergy especially, chances of recurrence is there. So you have to be in regular follow-up and normal cleaning of all the sinuses. Now, there are some refractive surgical cases. That means it keeps on coming. And the medical and treatment failure also will be there. So the patient says, I have undergone surgery for the same reason for more than 2 to 3 times. In such cases, if you take when you take history, they say he is suffering from severe bronchial asthma, breathing difficulty too. In that case, we would like to give you monoclonal antibody injections. There is omalizumab injection. So it is given in 2 doses in subcutaneous, and the side effects are some of the patients they have severe anaphylaxis. Now, and it is very costly injection too. Take home message. What all things you are supposed to do at home? You are supposed to drink a lot of water, plenty of fluids. Let it be in plain water or any juice also is okay. And you need to take balanced diet, not too much of oily food. Try to avoid spicy food. Wash your hands properly and avoid smoking, or quit smoking and avoid passive smoking too. Proper control of allergy is important. See, I have my own video on the topic called allergic rhinitis. So you have to type Dr. Zakir Hussain ENT allergic rhinitis, in which I think in part 1, the second half, I have detailed, part 2 allergic rhinitis, I have detailed about the medical management and the prevention of allergic conditions. So if you can go through that, it will be helpful. So you have to wear a mask too and try to avoid cold environment, especially direct blow of fan or direct blow of the air conditioner right into the face, and don't keep the room very cold. That is not good for you. And little bit of humidification is also better. So this is how we manage allergic fungal rhinosinusitis. So